So let's discuss about rigid gas permeable lens. Just remember the term rigid, it must be rigid. Another important point is gas permeable. Okay, so for example, glass is not a rigid gas permeable material, for they cannot pass. At the same time, PMMA is not a rigid gas permeable lens because PMMA do not pass the gas. It's a rigid contact lens but not rigid gas permeable contact lens material. What do you mean by that? Mean it must be rigid, at the same time it must have a capacity to permeate. It must be permeable to oxygen, isn't it? It must have decay. So PMMA has decay is 0, so it's not a RGB material, it's only rigid material. Okay, so that's the difference. So I have taken this data from this book. Okay, that's very good book, I love this book. And fifth edition, I think it came 1 year or 2 years back, 2020, I don't know, 23, 24, but it's pretty good book. I have read fourth edition like fully, but fifth edition is also best, and definitely new things are there. And moreover, this book contains clinical aspects as a core clinical setup, how you do things, how an optometrist interpret it. So I recommend this book very strongly. Okay, spherical RGB uses declines. Definitely it's decline as the soft contact lens material increases. Soft contact lens material market definitely has higher value market than GP material. But specialty lens, especially orthokeratology for myopia control, irregular corneas. Is there any other soft contact lens has option for irregular cornea? No, definitely not. For irregular corneas, only rigid gas permeable material is the option. Why? Because rigid gas permeable material will create tear lens, and tear lens will definitely hide irregularity of the cornea and gives vision, basically hide all the high order aberrations. And definitely in presbyopia market, yes, but one of the greatly increasing market is scleral lens. Scleral lens, definitely RGB lenses. In scleral lens is definitely rising each and every year. Okay, in US practitioners, this is also taken from this book, the data. Practitioners fit out overall RGB material. 77% RGB material are corneal GPs, 30% RGB materials are scleral, 7% RGB materials are hybrid, 4% RGB orthokeratology. Okay, so GP lenses used in US is from increased from 8% in 2014 and 11.4% in 2018. Okay, so it's increasing, I think, till 2018. Now this scleral lens is basically going up every day, because the scleral lens, I think it's a magical lens, it's always a magical lens. So internationally, GP lenses used as remain stable about 10%, but I think it's increasing a little bit, but increasing, yes. So let's move further. This is the data I have already talked about, that 77% of total RGBs covered by corneal GP lenses, 13% by scleral lenses, it's definitely increasing, and hybrid lenses 7%, orthokeratology 4%. This data, this picture is also taken from this book, yes. And again, the contact lens fit and refit material classes. So what are the material classes contact lens fit and refit? Silicon hydrogel is highest, like 39%, hydrogel 19%, GP 9%, hybrid 2%, and it's still PMMA is fitting, but I don't know about I have never fit the PMMA, so I don't know, and I don't know about that thing. But yes, definitely GP is third most, yes. But I think GP is the loveliest material of all. I don't know why, but I love GP material. So I have also taken this picture from this book. So what are the benefits of GP materials? Basically, what are the benefit of GP materials? So sometimes author of this book says that do not say RGP, rigid. So because you say rigid, the patient will think that it's something hard going on in their eyes. So always try to tell GP, which means simply gas permeable. That's, I love that concept from the author. Yeah. Okay, let's move further about benefit and the quality of vision. So basically, proper fitted GP contact lenses provide best vision result of any correction of option. Basically means best vision in any correction. Soft contact lens. So whenever I ask a student which one is better, soft contact lens or RGB for the vision, and they say soft contact lens because its name like this soft. But remember, quality of vision for is always higher in GP. Okay, no matter what, it's always there. So yeah, it must be that you must fit your contact lens properly. That's the first criteria, whether it's GP or whether soft contact lens. But in compared to soft contact lens and RGP, considering all the parameters aside or equal, then definitely GP will give better vision. There is no question. So GP lenses deliver near aberration free vision with a superior optical. I have already told you why near aberration field of vision, because of magic of tear lens, isn't it? Because of the tear lens. Tear lens hides, try to fill up the irregularity of the cornea, and pure tear lens will help definitely to reduce the aberration. So that's why it delivers nearly aberration free vision, superior quality of vision. So because superior quality of vision of GP lens in compared to soft contact lens is also there, because GP lens holds the tear lens. So study shows the better visual performance with GP lens versus hydrogel lens. It's always there. GP lens will give better vision. So GP lenses include fewer higher aberration compared to soft contact lens. That's all. I have already told you. That's all. Okay. So they are useful for optimizing vision in the corneal scar. Definitely, that's what we always do, isn't it? Scleral lens. In scleral lens in cornea, yes, definitely we have to say the cornea retinoscopic reflex, and then if there is retinoscopic reflex and through a scar or what, we have to try scleral lens because it will create magic. So GP lens, I'll definitely talk about it. Why we have to try scleral lens? Why scleral lens work magically? I'll definitely talk about it in tear lens section. I think I'll talk about it because the basics of optics, why it happens. Okay, GP lenses maintain surface wettability better than hydrogel lenses. It's always there because of surface wettability because of tear lens. So less deposit formation than software content, especially non-deposit disposable lenses, because compared with the soft contact lens, which is definitely non-disposable, we yearly use, and at the same time 1 year old RGB lens, you will find definitely RGB lens has less deposit formation than soft contact lens because of pore size or maybe all of things, but less deposition definitely compared with soft contact lens. So ideal when spherical refractive mirror slash cylinder ratios is 2 is to 1 and greater than 2.5 diopter cylinder, bitoric design is stable vision. So it's the recommendation, yes. But ideal for whenever there is a 2 times sphere and 1 times cylinder combination of refractive error. And yes, definitely there are a lot of things we have to consider, and we will definitely make discuss about it slower. Okay. So benefit ocular health. The smaller diameter and movement allows the good tear exchange and debris removal. So tear exchange has two major benefit. One is debris removal. Another is bringing fresh tear, and fresh tears hold fresh oxygen. So approximately 10 to 20% of tear exchange is there, and 10 to 20% of oxygen delivery is due to the tear exchange. So good tear exchange is essential for the fitting. Yes, GP lenses offer high oxygen probability depending on material. Yes, it's one thing is depending on the material. So we cannot say that balaflicon or for example lotraflicon in silicon hydrogel is more decay or have more decay or some GP material. It's dependent upon the material, but at the same time, GP material has that capacity to have good tear exchange. Yes, and that will also add some oxygen besides from directly diffusion from the material. So good surface wettability improves ocular health outcome. It's definitely there. Yes. And definitely we will going to talk about that surface treatment, not surface treatment per se, but yes, we are going to talk about some treatments in the last of this video. So clinical studies show GP lenses are safer than soft contact lenses. It's always there. It's always there. No matter what type of infection you are studying, GPs always have less chances of getting infections, especially like microbial keratitis and all this stuff. So yes. So less corneal staining and peripheral corneal infiltrate compared to tight soft tight fitting soft contact lens, it's always there. Lowest incidence of corneal inflammatory events among the lens type is always there. Corneal inflammatory events is higher in hydrogel contact lens, definitely, but it's lower in case of GP materials. So other benefits are lower incidence of microbial keratosis, as I have said, than soft daily soft wear, and lower than the extended wear. Extended wear soft contact lens are like extremely risky, isn't it? In UK study, GP lenses reduced risk of microbial keratitis by 84% compared with replacement soft contact lens. So I think these percentages are differ by country to country, more type of study methodology. But yes, definitely GP contact lenses has less risk of microbial keratitis, one of the major uh, side threatening corneal infection. Yes, so less binding of pseudomonas and acanthamoeba to GP contact lens than soft contact lens. Yes, and few steady. Lower incident of GP. Yes, that's also things. Lower incident of giant papillary conjunctivitis definitely with compared with soft contact lenses. Practitioner agree strong on ocular health advantage of GP lenses. Yes, I don't know about all practitioner. I am big fan of this point. I'm big, not just a fan. I'm big fan of this point. Practitioners agree strongly on ocular health advantage of GP lenses. Yes, you will not find one contact lens practitioner and who's not falling in love with the GP materials. Yes, patient, you cannot, I cannot, I cannot even teach patient how beautiful this GP material, because it takes a lot of effort. But as a practitioner, when you're talking one contact lens practitioner with another contact lens practitioner, we all agree that GP lenses has advantage over soft contact lens. Always, we always love GP lenses, no matter what. See, no, but it's very strongly, not just strongly, very strong. GP materials are very good. Okay, so let's talk about the applications of RGB. So myopia reduction, which means directly means orthokeratology. Okay. So conventional GP may slow myopia progress and do not affect the axial length. So basically, what basic principle of orthokeratology is also came by the experience of optometrist, the just flat fitting, and it changes the curvature of the, what do you call, cornea. So these are the data, but overnight orthokeratology reduces the myopia and slows axial growth. Yeah, we know this stuff, yes, from the myopia control. Slowing myopia progression reduce the long-term refractive error of the child. Yes, we know it. Peripheral retina hyperopic defocus deliver axial growth, and orthokeratology shift this myopic defocus, slowing eye growth. Orthokeratology may prevent young potential myopes from the needing of correction. Yes, definitely. So we are not talking about orthokeratology, but orthokeratology is definitely a RGB material thing. Yeah, that's what we're talking. The application is myopia reduction. Second application is post-surgical or irregular corneas. I don't know. Without RGB material, you cannot do this. Soft contact lens, it's like almost zero that you do post-surgical or irregular corneas. Yes, there are stuff that we're talking about, but they're not helping. Yeah, the GP lenses are ideal for post-surgical or irregular cornea due to the optical quality and rigid structure. For example, irregular cornea keratoconus. Can you imagine fitting keratoconus with soft contact lens? Yes, there are some lens, but they're not working. How well scleral lens work in the keratoconus? How magical it works? Yeah, from 660 it went like 6966. Yeah, so GP lenses improves vision in keratoconus, reduce definitely high order aberration. Yeah, one case I have already talked about in epithelial mapping video, I think, from 79 high order aberration. So greater than zero point 0.5 high order aberration, we think, oh, high order aberration is higher. From 79 high order aberration, it went to 1.91 through scleral lens. Advanced keratoconus and through scleral lens, higher aberration reduced to 1.91, and his vision from, I think, 360 to 680, and that was quite a good achievement from higher aberration. So you will see all the contact lens practitioners, and they will tell you this kind of stories that, which I am sharing currently. Okay, reducing higher aberration is day to day story of contact lens practitioners. So enhancing quality of vision, yes, how thankful I am that practicing clear lens and seeing enhancing quality of vision of my patients. So I don't know, it's very very a grateful feeling. So that's thanks to RGB material. GP lenses improves binocular resolution, obviously. Okay, in keratoconus definitely. Reverse geometry lens design improves centration of post on, that's very important. Reverse geometry lens design improves the centration and post refractive surgical eye care. I'll definitely try to make one video on the terminologies of contact lens and one video on contact lens design. At that particular video we will discuss reverse geometry. What do you mean by reverse geometry and what is on reverse, basically conventional. Okay, at that video let's not just go into that reverse stuff. So corneal topography help fabricate lens for corneal irregularities from keratoconus trauma. Yes, definitely corneal topography will help to make that lenses. Hyper GP material optimize oxygen delivery to the cornea. Yes, nowadays it's very very good contact lens in materials, RGB materials in the market, so that we can make a good scleral lenses. Yes, definitely scleral lens, RGB lens, especially RGB corneal lens of 10 mm, which is very very helpful. So presbyopia, yes, presbyopia, RGB materials are used. GP presbyopia design include aspheric, multifocal, segmented, and translated design is used with greater 75% of success. Okay, I have taken this reference from the same book. The spherical GP multifocal outperforms soft contact lens, multifocal, monofocal, and progressive lens in contrast and visual acuity. So no matter what, contrast and visual acuity will always better in compared to soft contact lens by GP lenses. GP multifocal scleral lenses offer better vision with comfort and comparable to soft contact lens. Yes, it is there. So astigmatism, so you don't have to do, we have to worry about astigmatism. GP lenses naturally correct the anterior corneal astigmatism by tear lens, basically. Yes, so tear lens will correct anterior corneal astigmatism, not posterior corneal astigmatism, but anterior corneal. High astigmatism subjects show improvement in visual acuity with GP lenses versus spectacle or soft contact lenses. Definitely, GP lenses will work magically because of the tear lens. Study shows majority prefer GP uh, vision over soft contact lens vision. I have already talked about it. Soft lens refit. What is that? The patient failing soft lens due to the poor vision or GPC can successfully refit with the GP lenses. So one of the, so if there is few cases in which you fit not soft contact lens, but or you fail from soft contact lens but you move to GP, is these two are very important. If patient complains poor vision with soft contact lens or constant GPC, giant papillary conjunctivitis, reoccur when you fit and you, there is something and then you treat GPC and again you fit, or maybe with daily disposable, then there is a problem, then you will definitely refit with soft contact and GP contact lens. Those eye with infection history and unsatisfied soft lens vision, yes, but infection history, I don't think patient wants to move in GP because they are very afraid with the contact lens itself. So high astigmatism patient with reduced vision due to soft lens rotation improves GP definitely. If soft contact lens rotates and there is a problem, then GP lens fit will definitely give best vision. And sometimes we don't need keratoconus to fit scleral lens. I have experienced that -5 cylinder without keratoconus, normal cylinder, but cornea is thin. Definitely, it's 478 something like that. And I remember that patient, and when I fit this scleral lens, then that's magic for her. So that was good. So emphasizing vision benefit and using topical anesthetics can improve GP adaptation, but try not to use topical anesthetics. But yes, sometimes patient first when you put the corneal lens especially, and then there is too much of sensation, then yes, first you can use topical medicine, anesthesia definitely, but it's always there. So GP material counseling is quite a difficult task, as I can say. So emphasizing vision benefit first, then topical anesthesia it can be used, but after all, a patient has to put his contact lens without anesthesia. So you must prepare him for the future. So, what are the limitations of GP materials? Let's talk about grossly. So, low adaptation to GP lenses. It's always there. One of the major reason of contact lens dropout, GP contact lens dropout, is low adaptation or sensation. Even in soft contact lens, one of the major. Okay, so 2018 GP lenses made only 11.4% of new fits or refit in US. So, data taken from this book. A reason includes ease of fitting soft contact lens, disposability, and ready availability. So, first reason is always soft contact lens is ease, very comfortable. So, consumerism and desire for immediate gratification reduce GP adaptation. Yes, definitely. So, main reason initial comfort difference between GP. That's crucial. That's hellishly crucial. So, initial comfort is main reason. So initial discomfort created by GP lens, that's why patient just said no. Okay, affected the patient interest and practitioner confidence. Yes, sometimes our confidence wavering because of that hard GP sensation in patient's eye and patient just feeling creepy. That's and sometimes even our confidence as a practitioner just falters. Yeah. So initial comfort, as I've already told, the most common reason of GP discontinuation is definitely discomfort. Even not just GP discontinuations. For soft contact lens discontinuation is discomfort. Yes, most important reason. So new GP wearer may feel mild awareness of tearing. Soft contact lenses are initially more comfortable due to the large diameter and less movement. Definitely, soft contact first material is soft. Again, its movement is less. Third is large diameter of soft contact lens so that its interaction with the upper lid is very less, but at the same time GP lenses the interaction with the upper lid are high. So comfort assessment is always its adaptation period for GP lenses 20 to 30 minutes. So pre-fitting evaluation can identify potential discomfort. So anxious patient may require soft contact lenses gradual adaptation. So basically means be aware that whenever you put the GP contact lens, and it must not be very loose fitting, otherwise it will create havoc there. So very loose fitting or loose fitting itself uh, will not adapt so easily. So like 20 to 30 minutes it's not there if it's too loose, or too loose lens will move out. But you understand the concept what I am telling about. Loose contact lens will definitely create problem even in adaptation. So completing 15 days adaptation phase can result high comfort. It's always there. You this number you can tell to your patient. At least from 15 days of adaptation, you'll feel better. Okay, on average 9 out of 10. It's always there. First is your job to fit it very right, fitting not too tight, fitting not flat, definitely not flat, but very good fitting. And then just tell the patient this number, which is very important. Roughly 15 to 20 days. I always tell my patients. So, what are the guidelines by Zedlika et al.? So, just the three step. First, proper presentation to the patient. Use topical anesthetics initially, not always. Allow optimum vision with the first lens applied. So, it's there are three things we can do for adaptation. Yes, for making good impression too. Scleral lenses on healthy eye provide soft lens like comfort while getting better vision. Scleral lens comfort is very good in scleral. It's like soft lens. Yes, basically corneal lens we have problem, not scleral lens. The scleral lens advancement were considered the top GP innovation in 2018. It's today also. Yeah. So lack of disposability. RGB lens we cannot make daily disposable. That's another thing. So GP lenses need back pairs due to the risk of loss, warpage, or breakage. Soft contact lens came in a 6 pack or 15 pair pack. Yes, and making replaceable easier. But RGB till date it's not possible that we make RGB like daily disposable. It's not till date it's not happened. So fitting inventory, soft lenses are easier to fit from the inventory. A small adjustment can be quickly tested. GP lenses are custom made. Change require new order and sewing definitely. And fitting GP lens, especially corneal lens, is art. You cannot fit GP lens like reading things. It will take time. Yeah, it will take really time. It will take your experience. It will take your knowledge. It will test your knowledge. Even corneal lens, it's like real difficult thing. Okay. So occasional cosmetic wear, soft contact lenses are allowed intermediate wear with minimum discomfort. Soft contact lens can also be change or enhance the color. GP lens smaller diameter limits them. So basically GP lens cosmetically, yes, sometimes GP means square lens, yes, cosmetically used, but rarely, and occasionally GP lens it's not there. Okay, environmental limitation, GP lens trap dust and debris more easily. Oh yes, because of the more movement. Patient working outdoor or dusty environment may be better suited for soft lens. It's debatable. Basically means it's debatable. It's soft lens means which material. So there are a lot of things, but yes, for this environment, even contact lens are very difficult. Yes. So athletics often benefit from soft contact lens, definitely, or square lens because GP use may be large diameter or low waist clearance design. Basically means GP cornea lens there are high chances of losing because of that athletic environment. Yes. So small pupillary size, GP lenses may reduce pupillary aperture size. What do you mean by that? Because GP lenses reduce the pupillary aperture size. Yes, because of long-term use and the blepharoptosis increased by GP lenses. So chronic lens removal may stress lead over the time and causing the levator apheresis adhesion. So these are the things. Basically, whenever you one of the technique of removing RGP lens to force the leads. Yes, if you force the lead constantly, then it can cause levator apheresis adhesion, and that will eventually cause a small pupillary size of eye. So I think that's it. That's I should stop here because it's too long. So I'll definitely try to get another part two, and we'll try to cover other things. Okay. So I think I will start from this slide. So Bistan, choose.